All right. Good afternoon, everyone. Charles Moscowitz here. How are you? My guest is Michael Betrus. He is the author of COVID-19 Lockdowns on Trial. And this book, by the way, is available at Amazon. What a cool cover, too. It's interesting.
Thank
Michael,
you.
thanks for joining me. You're welcome.
Thank you.
So let's start from the beginning of this pandemic. I mean, we became aware of it in early January. How did it start? Where did it come from? Is it a biological weapon, as some say, or is it a natural occurrence?
Without question, the consensus is it started in Wuhan, and it was sourced either from the Wuhan virology lab, and then it was transmitted from there into the wet market there, or it originated through an animal that was purchased in the wet market. And I think for my purpose and for the scope, I focused a little less on its origination than really what is the consequence of what the U.S. has done and
Right.
really the world's done to remedy this.
Right, and yeah, exactly. But I just want to set the stage a little bit.
Yeah.
And this is traditionally how some of the big viruses have started in China. There's a lot of bats. I've been told that there are bat caves in China that have more bats in them than the whole population of Manhattan, and that it spreads that way. And I hope they're not continuing with the so-called wet markets, but we'll have to see. Now, once it was identified at the beginning of the year, or even I think in the last part of December.
Right.
Now, my understanding, before we get to the actual politics of it as it unfolded, was that the Chinese government wanted to contain it and keep it out of the news. They did not want they didn't like the way it looked. It's kind of the way the old Soviet Union operated with Chernobyl. It didn't look good. They wanted to change the news. And they did so with the complete cooperation and connivance of the World Health Organization and the head of that organization, who was very close to China. The result was that it was 5 weeks before it finally was acknowledged by the WHO that this was a highly contagious or a contagious disease, and that before that they actually were saying that it did not spread from person to person. Is that how it unfolded?
That's fair. That is my understanding. And what's interesting to me that I cited in the book was that the World Health Organization, what was shocking to me was how harshly they condemned the initial, at the end of January, the travel ban between the U.S. and China, and citing that it would actually cause a worse effect. And I actually wrote a sentence that was like, on what planet does ceasing a border, halting travel between an infected country and a non-infected country stop the spread of anything? It was
Right.
crazy.
Well, it was very political because I remember when SARS was in the news back in the Bush administration, they shut down the border to Canada for a while. I mean, this is a disease, and the way you handle a disease is by trying to contain it.
Right.
And that President Trump was underwent withering criticism from liberals who said this is racist and xenophobic and all that kind of stuff, and
Right.
don't worry about it and go on out and go to Chinatown. You had Nancy Pelosi in Chinatown saying,
Right.
"Come on down, everything's fine."
Everywhere. That's correct.
But once it did unfold, it became a matter of public policy in this country and around the world. And by the way, there was also a travel ban on Italy once it became a hotspot,
Right.
to basically put everyone into a condition that can only be described as medical martial law. Was that a wise decision on the part of our government and other governments?
So what triggered me to write this book in the beginning and what I thought was interesting was I studied the cruise ship data out of just personal interest.
Hmm.
And the cruise ship data, really, we had 7,400 total crew and passengers, and we had between the two cruise ships a total of 10 fatalities. And when the first model came out that suggested or predicted in a do nothing scenario, we would have 2.2 million deaths. I actually pulled out my calculator and started reconciling the cruise ship data metrics with what was predicted in the model, and it didn't add up. The model predicted we would have had 155 cruise ship deaths. So I thought, wow, this doesn't add up. And then when we locked down California first, Illinois and New York the next day, uh, then it started to become very consequential. And when it started triggering tens of millions unemployed, that was when I decided to sit down and write the book.
So then the whole lockdown strategy was based upon these false projections, which were computer models, some of the same computer models, by the way, not to get into this, but that project global warming. But that's another topic. The point I'm making here is that those computer models turned out to be grossly exaggerated and not based on fact, but yet that was the model that was used to shut down those three states, which led to a virtual national shutdown.
Right.
Now, the actual virus itself, if you look at the casualty rates, and this is from the New York Times, this isn't some conspiracy theory. They say that it's over 40% of the people who have unfortunately died were people in nursing homes, which tells you that they're probably 80 years and up. And that probably, if you looked at that age category outside of nursing homes, that number can go as high as 50, 55%. Um, and yet, we did not handle it in a way that would protect people in nursing homes. And that includes in my own home state of Massachusetts,
Right.
but more famously in New York, where the governor actually circumvented federal regulations about putting COVID-19 positive people in nursing homes and did so, resulting in the deaths of thousands of people. Now, what on earth were they thinking? I mean, to my way of thinking, and they must have known, I mean, that this was, I mean, in the case of Pennsylvania, the head of the health department actually took out her 95-year-old mother before this went into effect. So she obviously knew it was coming down the pike.
Yeah,
What
it
was
felt
going?
like
What?
that one felt like the biggest example of insider trading I've ever seen, because at the same time the same exact week they were investigating some Republican senators for insider trading with respect to uh,
Yes.
right. And so to me, while that was going on, you had the state health secretary in Pennsylvania moving her mom. That was insider trading to me.
Perfect example. And it was the idea of it is so colossally wrong that anyone, a high school kid, could have known that you don't put someone with an active COVID-19 virus in a nursing home. It's
Yeah.
wrong.
And so the question that I pondered in the book was really less about the governors, because the governors aren't health experts and this thing was happening very rapidly. The people that I personally have held a little more culpable in this are, what was Dr. Fauci and the CDC director Redfield and Birx and state health secretary? Those are the people with medical backgrounds that should have really intuitively connected the dots that, hey, the in the data that we had from the cruise ships in Italy, the median age exceeded life expectancy. Somebody should have, with a medical background, connected the dots that nursing homes would be particularly vulnerable, and how that didn't happen and how that hasn't sort of come back to those individuals and entities is beyond me right now.
Okay, and I want to talk about them, but before we do, the other thought that I wanted to bring up is that different nations in the world handled the situation differently. And one nation sticks out in my mind, which is Sweden,
Mhm.
which did not do a lockdown, which still has not done a lockdown.
Right.
And yet they also, my understanding is they protected their nursing homes. Have they ran under the theory that the population would develop herd immunity, which is the conventional way that such viruses are handled. What has happened in Sweden? How have their numbers compared to countries that did do the lockdown?
So Sweden, the countries that locked down the hardest include the UK, Spain, Italy, France. Those countries all had higher deaths per million than Sweden. Germany had a lighter lockdown. They had fewer deaths. The way I look at it is Sweden's, let's just call them in the middle of the pack. Because 50 deaths per million to me is sort of statistically insignificant. What it validated, though, is that did the lockdowns, because the lockdowns, what nobody talks about is the huge consequence of unemployment and deaths of despair and untreated illnesses. And so you've got two levers. You're not just pulling one lever to try to mitigate the spread. What I think Sweden validated is that the lockdowns didn't really have a consequential impact. It was too far spread, too fast, and it attacked the vulnerable that just it really didn't have an immune system or had underlying conditions that were going to fall to this anyway. It's a very sad situation, but when you're talking about the consequence of lockdowns, did it work? The answer is really no. If you look at states, even in the US, there's no correlation between states that locked down harder and had better results. In fact, it's really the opposite. Now, I'm not drawing a cause and effect on the other. I'm just saying the lockdowns have been invalidated as a mitigation tactic.
Mm-hmm. And, look, I'm not a doctor here, but it seems to me that it makes more sense for people, younger people, to go out and develop immunity, maybe even have this thing, which a lot of them probably do. And then, there's been very few hospitalizations of anybody under the age, I think, of 30. It's extremely rare that it would be a fatal thing. It's just a very bad virus. But they then develop natural immunity, and that you protect the elderly. If they have an elderly person in the house, then that person, they should make arrangements for them to be isolated.
I agree.
During this time. It just seems like that's the more logical way to handle this crisis.
Yes.
And as you mentioned, and Michael, your research goes to this, the economic dislocation that this has caused is incalculable, both in this country and around the world.
Right.
The businesses that have been damaged, the fact the government has had to borrow trillions of dollars to compensate for people not to work, which devalues the value of the currency and which hurts the economy in the long run. The amount of people who are stuck at home, the social cost of people, young people not being able to go to school, and things like depression and marital stress and suicide, and not getting treated for normal diseases because the hospitals have all been told to keep everyone out, or people are too afraid to go even to get dental work done. Everyone is just hovering, and this all combined with this nightly barrage of fear and panic in the mainstream media, where you have, the usual people, Lester Holt, and every night, I mean, there's day so-and-so and how many deaths, and they put up the pictures of people, and they're acting like it's, yep.
And the cases, I mean, the number of cases seems to get so much attention, and it's this big number, 5.5 million. It'll be much higher soon, and that gets so much attention, and it stokes a lot of fear. The reality is, based on random samplings around, we are probably at more of a 75 to 100 million people in the U.S. that have been infected, and so it's almost impossible to believe that we will end up at a herd immunity phase long before a vaccine arrives.
So then you're saying that 75 to 100 million people in this country have already been infected. Let me just ask you a little bit about the virus itself and how it works. If you are infected and you don't know it, and in this case, we're probably talking about 90% of the people who have it. They don't know it, they'll never know it. They don't have symptoms, they never will have symptoms. Are they spreading it?
So it's a little inconclusive. It appears that if you're asymptomatic, you don't spread. That doesn't mean there couldn't be some outliers or exceptions, but generally speaking, asymptomatic carriers have not really proven to be, let's say, large-scale or probable transmitters.
Okay. So then it only starts to spread if you start to experience symptoms, and then you're obviously emitting the particles that spread the virus.
That's correct.
The other thing is that I think the CDC has now acknowledged, or maybe I should say admitted, that it is not going to spread from food or from packaging, or it's not likely that you're going to catch it from touching a doorknob. Because, I mean, I know people who are just in a state of panic. They're walking around with wipes, wiping everything down, and
Right.
they bring groceries and they're wiping, and then they're washing, and they're then washing again, and it's just not likely that it's going to spread through that means. Is that right?
Yeah, so most of the transmissions have all been traced back to either hospitalizations or hospitals. and then it's spread there, and then within families. There really hasn't been a lot of tracing that's resulted in hospitalizations or fatalities that's gone back to sort of congregations, shopping, going out, like that. Gyms, for example, have in Europe, they've done some tests, I think particularly in Germany, where there's not been any tracing back from people going to gyms, and yet what we've sort of done is this peanut butter spread, one size fits all sort of lockdown tactic versus doing something more specific, which is at the end of it, we'd end up in the same place if we lived completely normally. But if you were under 60 and severely obese, you would definitely be at a high risk category. If you're over 75, definitely be cautious. If you've got hypertension or a respiratory condition, those are the types of things that you would be vulnerable. My mom and her husband are 88, living in Detroit, which was very hard hit. They live in the city, and we've kept them under lock and key. I mean, we have been very cautious with them, and that's really what we should be doing.
Right. I mean, it's really a matter of personal responsibility, and the government would play a role in terms of educating people with regard to who is at risk, protecting nursing homes, concentrating on hospitals and making sure that people have enough supplies and the PPPs or whatever to be properly gowned and covered for this. The other question I have, and I don't even want to mention this by name because if I do, I could be taken off of YouTube.
Okay.
But it is the name of a particular drug, and I think you know which one I'm talking about. We're not going to mention it. It rhymes with, well, let's just, it has a long name, okay?
I know which one.
You know what I'm talking about. We can't mention it on YouTube because the Nazis over there might pull my show if we mention it for some reason. I don't know why. There have been 54 studies because you can talk about it on television, and they do talk about it on Fox News because Fox News isn't controlled by the same people that are controlling the internet. There's been 54 studies around the world which indicate that this drug is effective to treating the virus at its early stages. I mean, the 4 or 5 studies that were done which showed it was not effective were done with people who were so far advanced that probably nothing could help them, or there were other faulty elements to it. And there are a lot of doctors now coming out and saying this, including this Dr. Reish from the Yale Medical School, who's a certified and nationally respected epidemiologist, and others, who are saying that this drug is effective and that it has been on the market for a half a century. It's relatively safe. All drugs have risks. You have to read the fine print, and don't go out and take it unless you have a prescription and you have doctor's oversight. But it has been proven over and over again to be effective, and I understand it is being used extensively in certain countries, particularly Taiwan. I think France has used it, Israel's used it, some South American countries, and it is quite effective. Why is it that this is being shunned and demonized in the United States?
So it really started in March, it started in early April, and it started in Michigan. That was when the firestorm started. And you had it banned by Governor Whitmer. And then a couple days later, the state representative, who was a Democrat, took it, who was COVID-19 positive. And she had great experiences with that, made her feel better. She gave a public endorsement to it. I think 2 days after that, Governor Whitmer rescinded that ban.
Right.
And it's very, it's when does it start to be political versus one, we're trying new things. In that sense, you're kind of wartime governing. That should have alone been kind of like, let's try anything we can and see what happens, because this was new. And then the second thing is just over what the following 4 months, like to where we are today, why this has become it's become a big piece of drama solely because the president started that. And it seems like in a situation like this with the virus and with this pandemic and all the lockdowns, politics should really be superseded by let's come together and see what we can do. And it's become so political the last 4 months. And I feel like that's really superseded us getting through these lockdowns.
What you're saying then is that because of politics and because of this hatred for President Trump, that's like overall, uber alles, if you don't mind, to the degree that they're willing to have people die across the country so that they don't take a drug that they know about. The other element that I think plays a role in this is the fact that, the drug, I don't want to say it, is cheap. It's like it's a generic. It no longer has a patent, so it's produced and cheaply, and you can buy the drug for $20, and you can get enough dosages to last the length of a prescription. Uh, so the drug companies, and I don't mean to be cynical here, but they're not going to make too much off of that drug, and that there's a big rush to come up with this big cure that's going to cost who knows how much.
Who knows?
Um, and not to mention vaccines, of which our government is now earmarked, I think, hundreds of millions of dollars to drug companies to create. So maybe they don't want to have a $20 drug that you could buy in some countries over the counter that's effective. That's kind of going to throw a little crowbar in this profit-oriented idea. Now, am I being cynical on that, or do you think that might be the case?
Honestly, I don't know that I'm educated enough on this or have a strong enough opinion, but where I can go with your lead on this is there's about an 80% correlation between states that have heavy lockdowns and their Democrat-like governors. And then there's about an 80% looser lockdown by state with Republican governors. So that's fact, cited that in the book. And so you do wonder a little bit, hey, is this getting political? The other thing is, there's almost, again, I would bet a year's worth of yard work that we're going to be at a herd immunity type of phase where this thing is winding down before a vaccine comes. And there was even a poll that came out. It was a CNN poll last week that only 55% of respondents would even take a vaccine. And so the question that I've got over this, getting into the whole politics side of it, and what are we doing, is Michigan State University just shut down their school. They went to online classes right after registration. Michigan's got, 5 to 10 COVID-19 fatalities a day. I'm not minimizing that, but that's a very small number of their total. Michigan on average would lose 100,000 people a year.
And by the way, what age are those people generally? I mean, is there records of that?
Yeah, so the median age is between 78 to 80 in the US, but in general, the median age of COVID-19 fatalities exceeds life expectancy in every single country. That's not minimizing those individuals. It is saying you can identify a certain part of the population that's vulnerable and maybe have a more tailored response for those individuals that have either that age segment or the certain underlying conditions. And kind of everybody else is able to, I don't mean go about their social life, but you're talking about 40 million people that are unemployed. You're talking about millions of kids that are out of school right now. You're talking about deaths of despair that I predicted. You alluded to this earlier. Deaths of despair include things like overdoses. Let's include in that even domestic violence, suicides. We're going to end up and then if you add into that the untreated medical ailments that have gone unchecked for 3 or 4 months, we're going to end up at a point that's where those individuals, we're going to have higher, I'm going to call those lockdown deaths. We're going to end up with more lockdown deaths than actual COVID-19 caused deaths.
Yeah, no, I mean, exactly. I mean, the actual lockdown is causing more deaths than the COVID-19. And it was Federal Reserve Chairman Jay Powell mentioned in his interview that there's going to be a generation of young people who are going to fall behind. They're not going to receive the proper motivation, the education, the training, and it could cause huge long-term social impact on our society. Which brings me to something that, I know that it sounds like I'm taking out the tin hat here, and that's the way it goes. I mean, I have to speak my mind. This has caused a level of control over populations in this country that is unprecedented. It has never occurred in American history.
Right.
And because of the fears and the whipped up panic that affiliates with it and that has been used, I think, to promote that control, people are willing to give up their civil liberties. They're willing to not go to church. They're willing to not even go outside. And when they do so, they have to cover their faces, and they're
Right.
timid. I've seen people. I mean, I go to the supermarket. This woman is in a state of panic because somebody was going down the same aisle as she was going down, and
Right.
she starts to fall apart. I mean, people are in a perpetual state of panic. Isn't this a social experiment? And if it isn't a social experiment, it might as well be, in terms of like government control.
So certainly it's a way to look at it. I haven't taken the civil liberties approach on this. The way that I've looked at this is that the media has generated so much fear based on the headlines you talked about earlier, whether it's network news, cable news, print, hyping up cases, really not sharing good news. Like, we're at a 5-month low in COVID-19 hospitalizations. That should be a plastered headline everywhere. Everybody in the country.
We should be celebrating that.
And so the good news isn't really getting out there. And so I think that I almost feel like politicians are more reacting to polls, and those polls have been really driven by the headlines and by the media coverage. So I think if the media was generating a lot of good news, the polls would relax. And then I think that the politicians would probably change some policy to reflect that. And it takes a lot of mettle for a governor like DeSantis down in Florida, or Kristi Noem, and many others, to stand up to that pressure. And then when you look at Florida's results, they've been somewhere between the bottom half, let's say, of least impacted, and that's a hugely populated state with an elderly population.
With elderly, yeah, exactly.
So I feel like it's this media coverage that's driving polls, and that was the linkage I drew in my book.
Yeah, I mean, and I think that I know it's kind of said facetiously, but I've heard this said over and over again, that the whole pandemic will end the day after the election if Trump loses. And I know that's said facetiously, but I actually think that's probably true. And if he doesn't lose, maybe they'll run it for another 4 years. I don't know.
It could be. I also think one of the keys, like you mentioned the Fed chairman, there were a couple Federal Reserve Bank presidents, and I think in Minnesota and Dallas, where I am, that came out and said, well, everybody wearing masks is our key to getting through this. I think the key to getting through this is indemnification, because you've got so many concerns about liability at institutions, whether it's businesses or schools, K through 12 schools, and universities, that until we require students, teachers, everybody to indemnify those institutions, I'm not sure we are going to get back anytime soon. And with the risks so low, I think somebody's got to stand up, and it has to be one of our political leaders, and say, we're going to indemnify these institutions, and you can exercise your own free will to participate or not.
I think that's a point well taken. And while I respect Federal Reserve chairmen for their economic opinions or even their social opinions, they're not doctors. They shouldn't be talking about masks. There's a lot of controversy around that. It's not a known hard science. I mean, in Holland, they say don't use them. I mean, there are also negative elements to those.
Right, and Sweden's not wearing a mask, and so to your point of they're not doctors, I'm not a doctor either, right. But I've studied this. This is a data analysis. We have enough of a data pool where this is at this point a data analysis. On masks, there was no data that existed that was documented prior to March that said wearing a quote face covering is effective at blocking aerosol particles or pathogens. And then what you've seen, and even our Surgeon General renounced that and said in February, don't do it. Dr. Fauci said, hey, it's not really worth your time in March. He kind of wish-washed a little bit back by the time
he switched. Yeah, he flipped over.
And there's a plethora of data out there that prior to 2020 that said it's really not worth your time. A face covering is ineffective other than an N95 respirator mask. And I've got data on the top of my head if you're interested in that. But
right.
But the idea that that masks is our way out, there's no correlating data in the world or the US that connects masks with a decrease in cases, hospitalizations, et cetera. In fact, what you've seen is we got really diligent about this in Los Angeles. in the first week of June, and then in July, they had this huge explosion of cases. Why? Because it's a virus and it's going to run its course, and the masks isn't going to impact it. Same with Japan and the Philippines. They've been very good about wearing masks in the Far East, South Korea, and now in the last 4 weeks, they're having this explosion of cases.
Is that right? Okay. I mean, because South Korea is known to be extremely authoritarian on this issue. I mean, you could end up going to jail if you stepped outside your lawn in South Korea.
Right. And what's interesting, I mean, even prior to this, I was a platinum flyer for the last few years, and you would generally see either Asians or Asian Americans wearing masks even on flights or socially. I spent a lot of time in the national park, and even there you'd see it. And so that is a culture that's disciplined or used to.
I think in Asia it has a lot to do with air pollution, especially in Beijing, that people just got used to the mask.
But it hasn't impacted their case explosion this summer. It's a virus. It's just simply going to run its course. It has the same type of bell curve almost everywhere, and it runs through the hospitalizations and then the fatalities, the deaths lag. And within 3 to 6 weeks, the whole thing seems to wind down. That's why, like in New York State, Michigan, Illinois, states that were hit a little bit in the spring, they've got virtually no hospitalizations or fatalities now, which is great. And that doesn't get hyped up or
no, we don't hear about that. The same thing in Massachusetts, where I am. Now, I guess, Michael, my question to you is, we still are hearing this sort of rumbles about the next wave, and that when the weather gets colder, we're going to have a new virus. What's going on with that? Do you have any research on that?
So there isn't really a lot. Nothing exists. Well, the thing that's interesting, and I feel like it's really very positive news, is because it's a respiratory virus and we expected a seasonality, there was an expectation that we would have a summer lull. That really didn't happen in the South, where it's very hot. And in all these southern states, Arizona, the states, Arizona, Texas, Florida,
the border states, in other words.
So in these hot states, the infections have gone up to around 25%, maybe, and that was documented in July. So let's call it 30 now. Add that to T-cell immunity. It's unlikely that we will have a big wave, but you are going to have a flu virus, and so you're going to have a little bit of that compromised. But then a lot of people that would be susceptible to a flu virus this coming winter probably were already susceptible to COVID-19 or to SARS-CoV-2. Right. So,
and the flu is the flu. I mean, that happens every year. I mean, that's not going to be. I don't think that this country has the will or the interest to have another lockdown over that.
I would be very surprised if regardless of what happens at the election, that we would have another lockdown. I just don't think the country could handle it, and the data won't support it. And hopefully, voices like yours and like mine and others will get that out there.
So then, Michael, the virus, based on stats that we're looking at now, is in a stage of winding down finally, and is finally reaching its critical point of dispersion, would you say?
Yeah, I mean, so we're seeing consistently over the summer, we're seeing cases rise in a number of places. What we're not seeing is a commensurate rise in hospitalizations anymore. Like I said, we're at a 5-month low in hospitalizations. Cases are still very high.
Why has the virus mutated into a weaker strain, or why is that?
So I think there's two things that have happened over this. One, I can't speak to whether the virus has mutated, but I do think our hospital treatments have gotten much better. So we've got about a 40% improved survival rate from what we had 4 months ago. That is great news that hasn't really gotten out. The other thing is less susceptible people have gotten infected, younger people or healthier people, and they're, to what we spoke about earlier, either asymmetric or they've got such a strong immunity. I know personally a number of college-age kids, my son's in college, that have been tested positive. They've either been asymptomatic or had mild symptoms for weeks.
Yeah, my daughter too. Mm-hmm.
Okay.
College student. Yeah, I mean, it's not uncommon.
I feel like, Charles, we need to almost pull out of this and zoom out to a higher level and just think in a bigger picture. We've got a very, very high number of cases. We've got samplings that suggest, again, 75 million plus, maybe 100 million have been infected. Our hospitalizations and deaths are declining, I almost feel like an 8th grade math student could look at that and say, this is good news. It's probably proven to be not lethal enough to do these lockdowns, and we should get closer to back to
It's
normal.
all over.
But
I don't know. I'm kind of being facetious, but it's over. It's over. I'm not saying run out and expose yourself. Take responsibility. Take personal responsibility. But this pandemic, where the hospitals are, this emergency, where they're gonna the big hospital ships and the Heinz Convention Center being set aside for like thousands of people, that ain't happening. It's over.
That won't happen. We never reached capacity.
No.
Again, I'm not critical of those moves that happened in March and early April.
Well, they thought it might happen. I get that, but it didn't happen.
It didn't. If you knew by April it wasn't going to happen.
They spent hundreds of millions of dollars in Massachusetts setting aside the big convention centers, and they never got hardly anyone. They basically used it to house homeless people, and the homeless people weren't getting the virus.
Actually, I'm going off a little memory. I'm recalling that in April there was a study in Massachusetts in the Boston area with some homeless people.
Yeah, and they found that very few of them had it.
Maybe
they were drinking gin and tonics. I don't know. This drug we're talking about occurs naturally in tonic water.
Actually, there were no symptomatic homeless people that came out of that. The actual positive tests of that was one of the random samplings I referenced in my book. It was pretty high. It was about 25% or so. So the random sampling of those homeless people that was done in April, it was fairly substantial. I thought it was one of those things that said, why didn't the government, for all the quote civil liberties violations we might have had, and that's not really an argument I've taken on, but why haven't we done random samplings in major first tier markets like a Boston or Dallas or whatever, and then second tier cities, Des Moines, Iowa, whatever, or Austin, and done, but not a sampling based on the tests of people volunteering, but you actually, force this randomized testing to really see what we've got. I think it would be enlightening.
You're right, and I think the one of the main sticks they're using now to keep the lockdown in place and the masks is that if we let our guard down and we start to go back out to go to restaurants and go to events, we're going to spread it again and we're going to be back to where we were. Is there truth to that?
I think it's an impossible perspective. I mean, if you spend some time in Dallas, we've got a mask order, but the restaurants are full, and you walk in and you can be outside and not wear a mask. You have to put your mask on to walk in, and then you have to wear it 20 feet to get seated. It's absurd. And then you can be seated without it, and people are mingling. But
it hasn't gone up.
No, I mean, at this point, these little mitigation techniques, it's like trying to carry a bucket of water in your arms across a room. There's too many seepages, and it's not proving to be, again, the one constant we know after all this data, you don't have to be a doctor to know this, the constant we know is that the median age of this isn't going away. And the underlying conditions that are triggering a serious illness, hospitalization, or death, those have been constant after millions of cases around the world. We know what this is going to do and to whom, and to generalize a spread across each of these states with things like schools and the gyms and restaurants, it just doesn't make any sense. The data doesn't.
And so I think that to sort of wrap it up, the actual pandemic element of this, the fear that we're going to be swamped with millions of deaths, that never happened.
Right.
The literal, the fatality of it, the spread of it is lessening. And that is in spite of the fact that people are going out, they're going to rallies and protests, they're going to bike events, and it's still lessening. The point that I'm trying to make is, and I'm not here to speak as a doctor, I'm not here to tell anyone or suggest anything, but it seems to me that it's over. It is over. Get over it. The media won't tell you this, but, and again, in my opinion, it's all over. Time to get back to normal.
Well, I agree it is time to get back to normal. I do. We are at a point where there's about 8,000 Americans that die on average every day. And if you look at real-time deaths, so if you look at like an example that I thought was fascinating in June, we had about the mid-20s thousands of deaths. I bet I know most people don't know that about 50% of those were backdated. They were actual deaths from March, April, and May. So we're really running for June, July, August now. About 5% of all deaths are COVID-19, real-time deaths. Mm-hmm. And so we're barely at an epidemic level. And again, that doesn't mean that COVID-19 isn't real. It means our lockdown with respect to schools and the unemployment in businesses is
not real.
It's not proportionate to the risk.
And also, we didn't even get into how there's a lot of cases of falsifying information about the numbers of COVID deaths. That's happening all over the country. Hospitals have a financial incentive to call something a COVID death. Anyway, so Michael Betrus, you're the author of COVID-19 Lockdown on Trial. Where can people get your book, or do you want to give out information about where they can read your articles or more information about yourself?
The book is sold exclusively on Amazon, and so Amazon was the publisher. We went through some interesting trials to get there, and we got there.
Great.
And so pick it up at Amazon.
All right, will do. All right, Michael Betrus, thanks so much for joining me.
Thank you, Charles.
And we'll talk to you soon. Thanks a lot.
Thank you.